you have to be better as a woman to get the same recognition, to get the same respect, to get the same treatment. You can't be as good as the guy next to you.
You can be a mediocre man with a beard and a golf handicap and get promoted, whereas us women have to be perfect. Welcome to Fem MD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com. Joining us today is Dr. Sinehan Bayrak. She is a facial plastic surgeon. We have known each other for a couple years. It's kind of funny because we text a ton about little questions, little tips and tricks, business stuff. But this is the first time I'm sitting down and actually interviewing her. I get the sense that we're sisters from a different world in terms of our obsession with trying to get things perfect, even though we're still young in our careers. And to be fair, even the best in the world don't have perfect results. I'm super excited to chat with her today. We have tons to talk about. We're going to dive deep into some fun topics. Okay. Before we get started, I know you saw a post-op patient this morning. How are they doing?
Yeah. She's doing great, actually. It's so funny how everyone's so different. Like you do the same combination of procedures all the time. And, I think most people fall somewhere in the middle, but some people just bounce back faster. And she already had like a pep in her step, which was so interesting to see.
See, I get a little worried when they have such a pep in their step post-op day one, because I'm like, oh, honey, the pothole is coming. Just wait. Like, don't get too
Yeah.
excited. Don't overdo it.
That's a good point. I do feel like my approach usually is like I just scare them. Just I'm like, today's gonna be horrible. Today's gonna be the worst day of your life. I understand you feel good now and you don't even look that bad, but just wait, it's coming. So maybe I over prepare.
Okay, so I love that. You over prepare, you tell them it's the worst day ever. That's a pretty intense statement. I heard something the other day that medicine and surgery is just a hobby for intense people. What would you say to that?
I agree. I agree. I think it takes a certain type or level of insanity to do specifically what we do, which is not just surgery, but it's elective surgery, it's cosmetic surgery on people who are perfectly healthy. Like, talk about a gamble.
Mm-hmm. For sure. I tell people I can only make you sicker. Like
Hmm.
if you have a medical complication, the only thing I'm doing for your health today is putting you at risk.
Hmm. Yeah, yeah. So I do think, I mean, I'm just gonna assume that other people feel this way, but I know there are some days where I'm like, what am I doing? Like, because it's very stressful. Because things don't go perfectly sometimes, and you're just like, what am I doing? But then when they do go really well, you're like, oh, that's the hit I need. That's the drug that I'm addicted to. So here we are.
Why did you choose facial plastic surgery?
I feel like I don't have a great reason. Well, I'll start with like just why I became. People are like, well, did you always know you wanted to be a doctor? And I'm like, no, I didn't. I think it was one of those things that honestly, I was good at school. I was good in school, and it was just something that smart kids did. It was like, oh, you should you should go to medical school. And I was like, okay, I like a challenge. I liked the idea of it. And I think that's what got me there. And then once I was in it, I think you and I are similar in many ways, but I was like, I want to do the hardest, most competitive, most high stakes thing of them all.
Mm-hmm.
And, that obviously the answer to that question is different depending on who you ask. But for me, I was like, what is more complicated than the head and neck on the
Mm-hmm.
body? And if you go a little further, what is more risky than cosmetic surgery on the head and body?
What are some procedures you say no to? when people call in and want a particular or something?
Oh gosh. I mean, so part of, I think, getting busier and I guess just getting busier is the luxury to be able to say no to stuff. Ear pinning is something that I did early on. And I just find I find that I like working with adults a little bit better, just personally. And most people that require ear pinning are children. And I just don't find the same level of satisfaction from it. It is more anxiety provoking. You have someone's child in front of you. And beyond that, I know recently we've talked about the little things like the earlobe repairs, the mole removals, the scar revisions. I think I'm at the point where if I had an established patient who's been seeing me for years and, they just really want me to do it, I would acquiesce. Or if it's a small part of a larger thing. So, for example, I met with a woman earlier this week who is having surgery in July. Uh, Upper eyelids, facelift, neck lift, laser, fat grafting, kind of that's a typical day for me. And she was like, "Oh, by the way, like, would you mind, tweaking these piercing holes a little bit?" And I'm like, "Sure. Yeah, of course I would do it under those circumstances." But I think some of the smaller stuff and then some of the things that I just don't enjoy as much in terms of doing, because I only have so many hours in the day, just like you do, and I want to spend them doing the things that I love the most.
And doing them for people who you think are going to be happy with their outcomes, I would
Totally.
say one point of attention for me, growth wise, and looking forward to the next few years, is trying to siphon out the people preoperatively that I feel like just won't be happy with anything, even if I do provide my best work to them. So that's, something I've been talking to the team here about is, when we have red flags, we got to pick up on those early. We have to have more intense conversations with those patients. And then ultimately, if we tell them no, that's our prerogative. Like I can easily say no to a patient if I feel like they're not, realistic about what I can provide them.
Yeah. Um, do you want to know a great piece of advice that I have been given?
1000%.
And I think about it all the time. So I trained with a great man, a great surgeon, and he once told me, and obviously this is a little bit of an exaggeration, but I guess he said two things. He said, don't be in too big of a hurry to grow your cosmetic practice. And then number two was, when you do and while you do, make sure that people by the end of the visit and by the end of whatever conversation has taken place, you want them to be begging you to operate on them. You don't want to, you should never talk someone into picking you. You should never talk someone into whatever procedure, that you think they need, that they are not interested in. And obviously there are exceptions to everything, but the takeaway was they should be begging you because as soon as you touch them, that's forever. Like every good thing and every bad thing is now yours. And if you haven't talked someone into it, there's a little bit of a different understanding there.
For sure. And I think when the patient does have a hiccup or a complication, if they truly feel like it was their decision to move forward with surgery, it's not your fault. It's the universe's fault that they had that complication. And I think that's such a good piece of advice for those that are out there that are working in the cosmetic field, whether it's surgery or non surgical stuff. Like people should really be begging you. And actually, in my consultation that I do with people, I show them some of my own complications. And I literally say, I'm going to show you some scary stuff to talk you out of surgery today. And they always like shoot me a side eye, like, what? I thought I came here and you were going to sell me something. And I say, nope, I want to show you all the bad stuff that can happen.
Yeah. Yeah. I think it definitely plays into the like, I'm definitely of the approach to like over prepare people. Like, here's everything that can possibly go wrong with what we've talked about. But I agree, just to go back to what you were saying, patient selection, I think that is the most important thing. It's better than, or I'm sorry, it's more important than even, you know, really anything else.
Now, you've built a highly successful practice with 0 employees, and I've heard you talk about it before, but
Hmm.
w- walk me through that because I'm trying to simplify my life in some ways. Walk us through
Yeah.
how that's evolved.
It is crazy. It's crazy that it even works, to be honest with you. And I'm not gonna lie. So I've talked about this at a conference before, and I've talked about it on a previous podcast, but it is only sustainable up to a certain point, and it's getting to the point where I don't want to spend every waking minute doing the things that I'm doing right now. So that's my disclaimer is I don't, this is not for forever. It can't be forever unless you just don't want a life outside of this at all, which is not me. And but it initially started because I worked for somebody else and left unexpectedly and I had to kind of throw something together. I was dating somebody, but I was unmarried. You got bills to pay. There's a whole Destiny's Child song about being an independent woman. And I was like, I gotta figure this out. And what's so funny, my goal at the time was so low. I was like, if I can just get 3 or 4 people to see me per month, that I'm good. I can cover all my expenses. And it I was lucky. It blew up and it has continued to blow up. And I think there are advantages and disadvantages. I think ultimately it takes the right type of person. So I'm very detail oriented and I'm very tech savvy. And so it's not that I'm doing everything, but it's that I've found either software or platforms or subscriptions that can do a lot of stuff for me or for any human just by automating certain processes. And then whatever's left, I usually take care of, or a lot of I'll use the word burden, but burden is put on the patient. Like, if you want to see me, you have to make your appointment. And if you want to have surgery, you have to call your PCP and make your pre-op. I don't know if those are things that other people do for patients in your practice, but in my practice, you do have to be a little self-propelled a little bit, just because there's only one of me. But the silver lining to that is I attract people who are self-propelled. And I find that my patients now are so incredibly compliant, for the most part. And I think it's because it definitely weeds out, for lack of a better phrase, people that need constant hand holding.
Yeah, for sure. I recently visited another surgeon, you know who that is.
Hmm.
And that was a big takeaway for me is they select the patients that are motivated and compliant and are going to do the stuff preoperatively, which is a great um, sign that they're going to follow the rules postoperatively. Yeah.
Totally. Totally. And I've joked about this on Instagram before. And I guess what they say is true. Every joke has a seed of truth in it. But I mean, there are certain things that I pay attention to from the beginning. Do you show up to your appointment on time or early? Do you have all your paperwork filled out? How many reminders does it take to get you to fill them out? Do you even know what I do? And of course, as you get busier and busier, people, that changes. But um, I guess the take home message there is for patients maybe is like, I am watching everything from when you make that appointment. And because maybe it's crazy, but I think it gives me insight into the type of person somebody is. And I tell people all the time, surgery is the easy part in the sense that you and I are in the operating room. For the most part, we have full control. Like, if I don't like how something looks, I can redo it. After surgery, once we are out of there, the healing process is really, I think, the hardest part.
Oh, for
And
sure. For sure.
Like,
I tell people all the time, the surgery is the easiest part. You know, they're so
right?
nervous for the day of surgery, and I say, actually, that's the easiest part. You just go take a big long nap, and then the 2 week period after surgery is for sure the hardest.
Totally, totally. Like in my mind, the timer starts the second we hit PACU, the
Mhm.
recovery area.
Yeah.
So, I can give you the directions, but you have to drive the car. And I recently had someone who did a couple things she wasn't supposed to after surgery. And I'm pretty direct with people. I'm like, I cannot come home with you. I cannot do what you're supposed to do for you. I'm not trying to be a fun sucker or rain on your parade. I'm trying to protect you from yourself. Like these rules are there for a reason. And I think if you can do a better job at picking out who those people are,
Mhm.
you're going to make your life a lot easier.
Yeah. I want to shift a little bit and talk about, we're still somewhat early in our careers, but then on the flip side,
Hmm.
we have come a long way since medical school, residency, fellowship.
Hmm.
Um, Talk about some of the toxicity that you've seen as a woman.
Oh boy, I knew you were going to get to the good stuff. Um,
Had to get you lubed up
Oh my
first.
God, I know. Well, it's a good tactic. I'm a little warmed up now. Where to begin?
You can start in residency if you want.
I was pretty lucky, I think. Like I did my residency at a very large department, very large academic program, lots of female faculty. And I can't say that I really um, experienced a truly toxic environment during that time. Of course, there were certain people that you maybe didn't get along with as well as you did others, which is just life in general. I do think probably the hardest thing was it was very clear, or it was made clear to us by actually a female attending that you have to be better as a woman to get the same recognition, to get the same respect, to get the same treatment. You can't be as good as the guy next to you. You have to be better. You have to be nicer. You have to be more skilled. You have to be smarter. So I would say, and I wouldn't classify that as toxicity. I think that's a real life pragmatic lesson because I do think that's true. I do think that you have to be better
Yeah.
to get the same treatment.
And that talks about, less toxicity, more implicit bias.
Hmm.
You can be a mediocre man with a beard and a golf handicap and get promoted, whereas us women have to be perfect before you quote unquote get promoted. When she said that to you, like, did you already kind of feel that? Or was that like a brand new
Yeah.
window had been opened and you were looking out for the first time?
No, I think definitely. I already either subconsciously or consciously knew that because I think, especially in the field of surgery, I mean, where I trained, I think was unusual based on the number of female faculty we had. And in fact, my residency class was unusual because we had 4 residents a year, which is pretty big or was big at the time, and 3 of us were women. So we just had one guy. And I think I knew that it's such a male dominated field. And again, like I feel like I got really lucky. I feel like I was kind of in this video game of like dodging bullets or whatever. But I mean, I trained with great surgeons, men and women alike, and I never felt like I was treated a certain way from them. I more so felt like this is the world outside of here, and this is what you need to be prepared for. And this is why, you work as hard as you do right now.
Yeah, for sure. Let's jump ahead to your first job. You said you left unexpectedly. Talk about that.
So I think finding a job, any job, especially your first job, it's almost like a blind date. And it's hard because you don't typically sign a contract before you go on a blind date, but you do when it's a job. And I think ultimately it just was not what either side expected it to be. It was one of those things that sounded like it would be great on paper, and everyone thinks they're going to be the exception, right? So I worked for another surgeon, and it was a combination of specialties that you would think would go incredibly well together. But historically, like I struggle to think of anyone I know in that situation where it's worked out. And I've often thought to myself, why is that? I think ultimately it comes down to personality. Um, I think that certain personalities are attracted to certain specialties, and there can be clash there. I also think, I wonder if things would have been more successful if there wasn't like a sex discrepancy too, or I don't want to say gender discrepancy, but like, I'm a female, and most other surgeons, senior surgeons are men. And I think that definitely plays into it. And I also think when there's a big age difference.
Get more granular. Like what's an example of something that looked nice and shiny and pretty, but then when you saw it
Hmm.
in real life, you were like, ugh.
Mm. I would say a big office with lots of employees that seemed to run well, and people seemed to enjoy working there. My mistake was that I didn't ask people how long they had been there for.
Mm. High turnover.
Yeah. I think that tells you a lot, I think. Where I trained, the surgeon I trained with, he's had the same practice manager for over 25 years, and he has two other employees that have been with him for over 20 years. So I'm coming from that,
That's an incredible compliment to him and
right?
who he is as a human, not even a surgeon or a clinician, but just as like a human for sure.
Yeah. So I think, you're there for a day. Like things look nice, people seem happy. I thought I was going to get all these surgeries and my career was just going to hit the ground running. And I mean, to me, I was very much thinking long game, because from a financial standpoint, from a numbers standpoint, it was the least competitive offer I received for sure by a lot. But I didn't care about that. I've never really been motivated by money. And I think that's actually part of the problem. I think this might be an interesting point. I think that's a big generational difference between younger surgeons and older surgeons,
Why?
in the
Why do you
sense
think it's
that
changed?
I think we, maybe by watching them, have learned to value quality of life and time away from work. And I hate the phrase, but I'm going to say it, work-life balance, more than my third Mercedes, my second beach house. My kids have to go to this camp or that school, or we go to Europe every summer. When I took my first job, um, even though it was the least competitive offer I received from a financial standpoint, I rented a one-bedroom apartment. So even though I was making more money than I had, which isn't saying a ton because residents get paid like $2 an hour, um, I just, I don't, money's not the way to keep me someplace. Um, and I think that that is a big difference between older surgeons and a younger generation. Maybe I'm the only one that feels that way, but I care more so about being happy as cliche as that sounds, and feeling fulfilled in my life. And I forget who said this to me one time, but I tell myself occasionally, like, when you die, no one cares how many facelifts you did. Truly, no one cares.
Yeah. I get asked all the time, when are you going to bring on another surgeon? And I'm like, probably never, because
Hmm.
I think surgeons inherently have a difficult personality. Like, I would say I'm somewhat of a difficult person to work with or
Same.
for, and I don't want to deal with another surgeon. And I also think I'm like you, I'm not money motivated. Like, in my mind, the only benefit of bringing on another surgeon would be to increase our revenue. But I would much rather have more peace and calmness in my day than another zero at the end of my paycheck. Um, but I want to get back to the sex and gender stuff.
Hmm.
Do you think that as women, we have to censor ourselves more than men?
My God, yes. Like 100% yes.
So how do
And
you censor yourself?
I think at this point it's just kind of become like a skill. Like it's like breathing. You don't even think about it. I think when you're in training, you are definitely taught to speak a little differently, whether that's to the nurses or the respiratory therapists or the receptionists in clinic. Like you can't be as brusque or as chaotic as maybe some of your male counterparts, because they will be offended by it more and you will get in trouble.
Okay, so in residency, where I trained,
Hmm.
big academic institution, they had this anonymous reporting system that patients, families, employees of the hospital could go file a report. And it was for safety stuff, bad outcome stuff. And then you could also complain about the way you were treated, because that's part of
Hmm.
healthcare.
Hmm.
And I felt as though I had several complaints that were against me personally from employees of the hospital, whether they were other physicians, nurses, whatever. And so I approached the hospital administration. I say, I want to do a study. I want to look at this reporting system. I want to take all of the complaints against residents, specifically for the last, 2 years, whatever. And I want to compare how many of those residents were men versus women. And then I want to dive into, like, are the complaints the same?
I'm dying to know. I already know, but I'm dying to know.
The hospital was like, get lost. Like, you're no.
Oh, of
But
course.
I guarantee, because even in our department, we had a policy that, like, if someone got tattletailed on or something came up, we would have to talk about it at our morbidity mortality conference as like a little sidebar. And by far and away, us females were disproportionately called out for these like ridiculous things. Like, I remember one time we had like an emergent trach, like this patient's trying to die. I run into the hospital, literally park my car in like the right out front. I'm running in, I'm in my scrubs from a different hospital. I don't have a hairnet on. And we did an emergent trach with a basically a scalpel out of those peel pack ones,
A disposable one,
a
yeah.
disposable on their bed, like
Oh my God.
in the hallway. We weren't even in the operating room.
Oh
And I
my
got
God.
written up, and thank God she did fine. No anoxic brain injury. Um, it was one of the scariest airways, but I got written up for not having like the right scrubs on. And I was like, F off. And it was a female nurse who was there watching, like, how like seconds away from this patient, like losing her airway and having permanent brain damage. Like, why are you
Yeah.
reporting me?
Yeah. I mean, it's unbelievable, but it's so believable because everyone has those stories. It's like the most minute, inconsequential things will become a point of issue that people have with you. And it's like, dude, I'm just trying to do my job. And I can't just do my job. That's the problem. I have to create all this fluff and coziness around it. And I think for me, the most important thing to me is taking care of patients. I don't really give a crap about anything else, much less the scrubs I'm wearing, as I'm sure you didn't either. So yeah, I think you're taught it because of experiences like the one you had. And I would bet every female resident, especially surgical resident, has had. And then it just becomes part of you. And it's something that you do in order to be successful and not ruffle feathers.
Hmm. Now, the other day when we were texting, kind of a pinky in the brain moment where it's like us females have to get so good that we take over the world.
Mhm.
And I think a lot of the men in our field are the ones that are loud and braggadocious and the ones that get on stage. What do you see for our field and how we as women are going to grow with it? Do you think that we'll continue to censor ourselves around each other and at meetings? Or do you think in 10 years we will have to censor ourselves less and pretend less?
That's an interesting question because I don't know that I censor myself with colleagues, right? Like with each other, and you and I talk, and we have a group that we talk within, and I don't know that I censor myself the same way. I feel like that's something that you do with non-female colleagues or not colleagues, I guess. But I think because we aren't look at me, peacock, peacock, braggadocious, which is a great SAT word. I think to get the same amount of attention on those stages and on those panels, the results have to be better
Mm-hmm.
because there's less other stuff to be distracted by. But I think we're getting there. And I think just, from what I do and the people I meet, I feel like a female's understanding of another female is so different and cannot be replicated. And I think that is a huge advantage for us.
Yeah, because most of our patients are female.
Exactly. I was just going to say it. So I know, like, it's the simplest thing when someone comes in for an upper left consult and they're like, I can't do my eyeliner the way I used to. I'm like, girl, I know what you mean because I've had a brow drop before from Botox. And yeah, like you notice it immediately. But someone who's never put on eyeliner a day in their life would be like, yeah, okay, okay, sure. That sounds reasonable.
Yeah. Now, you mentioned we just have to get better, which I think you and I
Hmm.
are both very hungry. Our
Hmm.
appetite for improvement is there. And I tell myself that our field has this unforgiving call to perfection, right? Like the general surgeons of the world don't get assessed on how the stump of the appendectomy site looks or the stump of the gallbladder because it's hidden. All of our stuff is out there and visible, and patients are watching the healing. Our results, you can't hide, it's on their face. Where do you draw the line between, healthy perfectionism versus unhealthy obsession?
Mm. I think so. I think I do a couple things, and these, of course, have been integrated into my process over the years. You learn something from every patient. And I would say the first thing I started doing was I actually integrated a mini body dysmorphia questionnaire into my intake paperwork. It's like 4 questions, and it at least makes me feel like I'm doing something. And I look at those responses, and there's a rubric where, like, if you get 3 out of 4, it's like, oh, okay, this is cause for concern. I think the other part is I try to find out about people when I meet them. So like, yeah, I know what you're here for. I know you don't like your neck. I know you don't like your eyelids. Tell me about you. What do you do for work? Are you married? Are you single? Cat person, dog person? Do you have kids? Just give me an insight into your life because oftentimes people will tell you things where, if they say, I don't really do much. I hate like being in photos. I don't like mirrors in my house. I'm like, ooh, yikes. I don't think this is a good idea. So I guess listening, trying to figure out, get to know the person and not just like what they don't like on themselves, because everyone's got something they don't like on themselves. And I also, in every consultation, try to say something to the extent of, and I think I took this from Mike Nyack, and I maybe have strayed from how he articulates it a little bit, but I usually ask people, I'm like, so I have an 80% rule, and the 80% rule has two parts. When I meet someone and you tell me all these things you don't like and how you wish they could be better, while you're talking in my head, I am asking myself, I'm trying to figure out if with my skills, I can make those things at least 80% better. If the answer to that question is yes, you get a quote for the things that we're talking about. But the question you have to ask yourself, the second part of the 80% rule, is would I or would you be happy with an 80% improvement? And then I usually say something to the extent of like, I mean, I know lots of facial plastic surgeons, as I'm sure you do too. And in general, the field of plastic surgery doesn't really attract non-neurotic, non-type A people.
Mhm.
Like I'm very detail oriented. My goal is always 100% perfection, 110% in like improvement. But that's just not real life.
Mhm.
And I'm going to try to get us there, but I need a landing pad. And if you say, listen, I don't think I'm going to be happy with anything less than 90, that's something we can talk about. But it's better for us to have this conversation now than for me to, after surgery, a couple, maybe a little swelling lasted too long, or, one part of the skin flap looks weird. After surgery, it's not an explanation, it's an excuse. And so I rely on that 80% spiel. And usually people are very understanding. They're like, well, it's going to be better than this, right? And I'm like, yeah. But how much better determines whether or not I think it's a good idea for you to move forward, because there is no guarantee with anything, even with this.
So that's the patient side. I want to talk about
Mhm.
you. Like, are you
Mm.
happy with an 80% improvement?
No, of course not. Are you kidding? Oh my God. So this is where sometimes I know your husband's non-medical too, and I'll have like, as I'm sure you do, I'll organize photos at least once a week, and I'll put together before and afters. Oh my God, I will just rake myself over the coals for the tiniest of things. And I'll show it to him and I'll be like, look at this. Like, why can't that be better? And he's like, what are you talking about? She looks 20 years younger. And I'm like, no, like, see that bulge? There's a weird bulge there. And he's like, you are insane. Like, you need to calm down. So I think having that we're in it, and it's hard to be objective when it comes to your own work. We're also insatiable. So I think here's very explicitly speaking, here's my problem as a person, not just as a surgeon. And it is never enough. It is never enough. At the end of last month, I set goals for myself, and I hit this big goal that I didn't know I was going to hit or not. Just when it comes to like how the business is doing. I literally enjoyed it for 3 minutes, Lauren, maybe five. And then immediately my brain is, okay, if I can replicate this for the next 8 months of this year, I will triple whatever. And it's like, dude, you can't even take a second, you can't even take a day to just enjoy the
Savor.
success that you're savor. And I
Yeah.
can't because it's never enough and it's never going to be enough. And that is something that I've come to accept about myself.
I think we're sisters from like another life because I literally force myself. Like sometimes on Friday afternoons when my employees leave, I will force myself to go sit at my front desk and just like look around and say, Lauren, you have to savor this day, this week, this whatever, whatever. And I'll sit there for 30 seconds and then I get up and then I'm already worrying about someone having a complication this weekend or the before and after on my phone that I'm like perseverating over some little bump or pleat or whatever. And it's like, what? I think it's good and bad. I think that's what got us to where we are today and what's going to continue to push us to improve, improve, improve. But it's hard to turn the switch off.
Yeah. If you figure it out, let me know. But I agree. It's a double-edged sword. It's a blessing and a curse. I think it's what got us here. I think it's what's going to make us even greater in the future because complacency is where things fall apart. And I wish I could be complacent, like truly. Some days I wish I could just be like, pretty good, because guess who does that? Plenty of other people that we know.
Mm-hmm. When you stop growing, you start dying. That's my motto. And I trained with someone that was very old. I mean, he was a good surgeon, but I was like, God, you're not hungry at all. You don't want to learn anything. And I'm interested to see how our perspectives change over the next 20 years. I don't know if we'll
Yeah.
still be working by then. I,
Not at the rate I'm going, but that's why it's important to figure out what's important to you and, cut out everything else, I think.
mm-hmm. Someone told me a patient of mine who's having a complication and has such a good attitude right now. I always am very apologetic. I say, I'm sorry this is happening to you. I'm right here with you. I want you to heal quickly. And they go, you know what? I'm a body, not a bicycle. And I was like, I'm going to start using that. The human body is so complex. And like when you talked about having a
Hmm.
landing pad and the 80% improvement rule, the patient is this physiologic creature. We are these humans. And then we live in this universe that's so imperfect. So there's so much stuff that can happen. But yeah, I liked they said, I'm a body, not a bicycle.
Yeah, I might take that too. We should really, I mean, there are all these little sayings and stuff that you are very helpful to explain things or to conceptualize things. And I feel like we just need to make a big Google Doc of them.
Reminders when you're feeling like shit.
Exactly. Exactly.
The other thing that's morphed in my mind is, when I didn't hit the 80% improvement and we would go for a revision, me and the patient would decide to revise something. I think for the first couple of years, I considered that a failure in my mind. But now I'm forcing myself, I'm being intentional about telling myself it's an opportunity to open up, see my old work, see how it healed, look at what I missed, what I did wrong, what vector was incorrect when I was lifting them, and then allowing myself to use as an opportunity so that tomorrow's case, I don't make those same mistakes.
Definitely. Yeah,
Mm-hmm.
that's a good way of looking at it. And I think I felt the same way. But I will say, I've had to do a couple of my own tweaks now, and I have yet to regret doing one. Like, it is better. I can usually make it better. And, at the end of the day, like if I've done my job in terms of patient selection and you're a realistic, reasonable person, of course, like all I want is for you to be happy and look great. So if I think I can do that, count me in. The other thing that I've realized recently, and I think I read this on some Facebook group for facial plastic surgeon, but I think part of my problem, and maybe it sounds like your problem too, is I compare my results now to what I envision them being in 10 years. And when I do that, of course, first of all, that makes no sense. Second of all, I'm incredibly hard on myself. and they're just not what I want, right? Like because of, there's that drive to be better and better and better always. But someone said something where it was like every surgery, every time I operate, that patient gets the best I can do at that time under those conditions. And that really helped me, even though it seems so obvious. But it's like, well, I do leave every case feeling like I did the best I could possibly do under whatever conditions, whatever anatomy I was presented with.
That's so funny that you say that because in our office, the non-clinical women, like when we finish a big case, my treat to myself is I always go make a coffee and or an espresso. If they ever want to sponsor me, I'm obsessed. It runs through my veins. They always say like, "How'd it go?" And I literally say, "I did my best. I don't know. The cookies are in the oven. We'll see in a few weeks here how they taste."
Hmm. Definitely. That's a great way. Yeah. You just, I mean, I leave the OR every single day feeling like that was it. That was everything I could do at that moment in time with that particular patient. And I think that's ultimately what the most important thing is, right?
Yeah, yeah. Now you mentioned in one of your posts recently that sometimes women will come in for surgery and will have not told their husband or want you to conceal that from their spouse. And I sometimes get that too. What does that say about that patient, the concept of autonomy, privacy,
Hmm.
and even like the power differential in their marriage?
Hmm. Yeah. I think it's interesting for me because I would say a newlywed, I guess. We got married about a year ago. And I would say the hardest part about being married was the idea, especially when you get married at 34. Like I've I've been a solo operator literally for a long time now, but it's the idea that like, okay, it's not just you anymore. You've got someone else with you. Being in a field where most of my patients are women, and I myself am a woman who is now married, I think relationships have also evolved. I feel like I have a partner. I don't feel like I have someone that I need to conceal things from or ask permission from. So to me, it says more about maybe the relationship than it does about that particular person. Now, does that mean that that particular person doesn't deserve to feel their best and look their best? Of course not. But I kind of, I always like it when actually husbands come to consultations because it gives me an opportunity to number one, suss out the situation, and number two, prepare them.
Mhm.
Because, so I had a consultation recently, a few weeks ago, and like super pleasant lady, like just so sweet, great energy, would have an amazing result. Husband's here and he doesn't want to be here. You can tell. For the husbands listening, I can always tell. Okay. So you're not, it's not a secret. We know. And, I start talking, I'm all about preparation, right? So I start talking about what the recovery is going to look like and all this stuff. And he's like, well, I can't, I don't want to see any stitches. I don't want to see any blood. I don't want, like, I can't, I just can't handle it. And I literally, I guess maybe I don't know. I just maybe thought without or spoke without thinking, but I literally looked at him and I go, you may have to leave town then. Like truly, because what I don't want is for you to make a hard time even harder. And I've experienced that indirectly from patients before, where, when you have an unsupportive spouse going into something like this, it sucks. It sucks for me. It sucks mostly for the patient because that first week is like emotional support week. And honestly, that's why I see people multiple times during the first week, not really because I'm worried about something physical, but because I'm here to tell you, I know this is scary. It's all normal. This is all going to go away. And that makes them feel better. So it's a feel better visit. The last thing I need is for you to be the husband or the boyfriend or whoever it is, to be a negative Nancy and make a hard time even harder.
I have like a specific patient in my mind right now, and the spouse, I'm just like, ugh, get lost. Next, I'm going to tell him to, get out of town. I wish I
Yeah,
had told him that because
I
you're
know.
so right. And I tell people when they come in, I'm like, everything looks right on track. I
Hmm.
started by saying everything looks good, and they're like, I don't look good. And I'm like, well, actually, you don't look good, but everything looks right on track for what I
Yes,
did to you.
yes, yes, yes. And I'm like, listen, most people at this point, they find me through Instagram or word of mouth. And I'm like, you remember all those pictures you saw on Instagram that you really liked and ultimately made you sign up to have this done? They all looked like this too. I promise you. I promise you. I find that, sometimes I tell the patient actually, I'm like, listen, if you think your guy is going to be kind of a stick in the mud, do you have a sister? Do you have a friend? Do you have just someone that you can camp out with for 2 weeks? Because it it's not impossible when the partner's not supportive, but it's a heck of a lot less enjoyable and way more stressful when they're not. And it affects the patient. And again, at the end of the day, my job is to make sure that the patient does well, whether that's surgery, whether that's healing, whether that's external influences like unsupportive spouses.
Yeah. Well, Dr. Sinehan Bayrak, I want to thank you for today. I want to congratulate you on being a newlywed,
Mm.
congratulate you on your new practice, congratulate you on the business milestone that you hit. And I hope that today you find time to savor the success that you've had.
You too. I could say the same to you. It's just the pot interviewing the kettle, I think. But this has been awesome. I always love talking to you, and I think we're a lot alike in how we think and what we want out of our careers and out of our lives. And I think this is the stuff we've talked about that people don't think about that much. And so I think it's going to be a good insight into our brains, so to speak.
Thanks for tuning in to Fem MD. And remember, the world belongs to the women who question it.